There are some do's and don'ts that your nurse will go over before you leave the hospital. You can also find this information in your spine surgery handbook. Driving after spine surgery is a risk, especially while on prescription pain medication. So plan on the patient being a passenger for at least 2 to 4 weeks and maybe as long as 12 weeks. For cervical patients, no driving while wearing the cervical collar. Talk to the surgeon at the 2-week post-surgery appointment about driving readiness and returning to work. These are generally dependent on how you are feeling and the type of work you do. Be prepared, as some patients may need 12 weeks of rest and recovery before returning to work. The surgeon will give guidance on this at the follow-up appointments. Whether at work or at home, don't lift anything over 10 pounds until the surgeon gives the okay. That doesn't mean no activity. It is important to keep moving, but take it slow and do the recommended exercises. Walking is the best thing for preventing many complications. After a few months, outpatient physical therapy may be prescribed. Ask your therapist about a gradual return to using equipment in a gym facility or at home. Follow your spine precautions for as long as your surgeon feels necessary. For back patients, typically 3 months. For neck patients, expect between 2 weeks to 3 months depending on how quickly you heal. Remember to limit bending, lifting, and twisting. For back patients, no bending at the waist over 90 degrees, no rounding of the back, and have good posture, and no twisting at the waist. For neck patients, no bending at the neck or moving the head up and down, no twisting at the neck or moving the head side to side. And remember, for both back and neck patients, no lifting. Follow the lifting restrictions in your discharge paperwork. Typically, this is 10 pounds, about the weight of a gallon of milk. Follow these precautions for 2 to 12 weeks based on your surgeon's recommendation. To ensure you are safe at home, make sure all pathways are clear. Remove rugs, cords, and anything that might get in the way of going to the bathroom, bedroom, or kitchen. Plug in night lights to illuminate the path. Keep the most frequently used items at waist level and nearby to avoid overreaching, twisting, or falling. Everyday tasks like getting out of bed, getting dressed, and taking a shower are going to take longer. Don't rush. Rushing affects balance. So does mixing alcohol with prescription pain meds. Keep pets in another area if they are likely to jump. And until the surgeon gives the okay, no walking dogs heavier than 10 pounds. Follow good lifting techniques for the rest of your life. Bend at the knees, also focus on having good posture. Not all patients will need a brace, but if you have one, wear it as instructed. Preventing falls is really important. If you use a walker in the hospital, use it at home for at least the first 2 weeks or until your surgeon gives the okay to stop. Limit stairs as much as possible during the first 2 weeks, no more than once or twice a day. Going up and down the stairs may be difficult at first, so having someone to help is a good idea. The person helping stays on the stairs below the patient to provide support and prevent falls. If there is a fall, immediately call the surgeon. Even if it seems like it's not a big deal, every fall is a risk for complications that may go undetected if the surgeon is unaware. Keep your guide to recovery nearby and refer to it often. Your surgeon is your partner in care. Don't hesitate to call with any questions or concerns. The surgeon may recommend a visit to the office, which is preferred over the ER because it is less expensive and limits exposure to germs. If the situation is life-threatening, call 911. Watch the other videos for other important information. Recovery is a process. Be patient and know we are here to support you.